we need to remember when we're having conversations like we've had in this hour about Social Security or about workers' wages, that as critically important as both those things are, they exist, they're suspended in a kind of larger matrix of forces that is keeping wages low, that is coordinating this assault on Social Security, that is acting in its own self-interest. And that, of course, is the unholy intersection between our politics and the economics of the very, very wealthy. Now, one other area where we need to push back on this unholy alliance is healthcare. People wonder, I worked in the healthcare field for many years, and people wonder why today I'm such a strong advocate for Medicare for all. I'll tell you one reason why. Because I've seen the inner workings of the for-profit healthcare or health insurance industry. It's not healthcare. And I know how inclined it is to maximize profit without regard to larger concern, not because the people who work in it are bad people, but because they're immersed in a culture that allows them to think a certain way. And I'm also not enamored of any typical Democratic half measures, let's beef up the employer-sponsored system, because I don't think the employer-sponsored health insurance system is working very well. And a new report just confirms, I've talked about this before on the show, I've written about it, but a new report just confirms my suspicions. The report is from the Healthcare Cost Institute, or HCCI. It covers costs through 2016, and it's the annual report, and it takes a while for this data to come in, which is why it's going back to 2016. U.S. healthcare cost and utilization trends. Now, here's the part that I find significant right now. Finds that Americans under the age of 65, meaning not eligible for Medicare, who were insured through their employer, spent more than ever on healthcare, and spending grew faster in 2016 than in recent years. Now, when we say that spending grew faster, bear in mind that for many Americans with employer-sponsored health insurance, out-of-pocket costs and premium costs were already prohibitively high. The actuarial firm Milliman studies that. More than $10,000 average cost when it's all put together for the typical family of four with quote-unquote good health insurance. Now, that is growing rather, as of 2016, by 4.6% per year, which is compared to only 4.1% in 2015, which is already way too high on a base that's already way too high, and is much quicker than inflation overall, much quicker than wages, so people just can't afford the health care they're getting through their employer health care system. Now, some surveys say people are quote-unquote happy with their employer-sponsored health care, but that doesn't include the people who have actually needed health care services in the last year. They tend to be far less happy. Now, the spending growth that they saw every year for 4 years was almost entirely due to price increases. Drug prices are going way up, and so are emergency room admissions and hospital surgical admissions, both going way up. These are, of course, pharma. Big pharma is all corporate. Hospitals are increasingly corporate. People can't afford it. And to kind of confirm that, they say use of most healthcare services, utilization stayed flat or went down. And that's because people can't afford it. Consumer out-of-pocket spending increased but grew more slowly than total spending. Well, that's because I suspect people are using less, and that doesn't even count the runaway cost of premiums.